She is good.
Got that quick trigger.
Yeah. Don't roll up on her without announcing yourself. There's like no gun
Welcome
on
to
the
the
table
Grappling with
today. Oh, there it
Podcast.
is.
Dr. Chris Hardy and William Walker will take a deep dive into topics covering wellness and prevention, performance, recovery, and injury management. Our mission is to provide the latest science-based information to help you get the most out of your grappling journey, both on and off the mats, and help you overcome
Wanna be
any
like
challenges
Kyle?
you may be grappling
This is
with.
where your
Dr. Hardy
holster
is a
is.
licensed physician and
Where
BJJ
your holster
practitioner, but the
is.
contents of the podcast are meant for educational purposes only and should not be taken as medical advice. Please seek out
realize he was
personalized
giving
care
that to
from
you.
your own medical provider
don't
prior
think
to
he realized
implementing
it either.
any medical treatment or intervention.
Hello.
Hey.
We are Sans one non-binary doctor.
He'll be here shortly.
He will
He's putting
be.
his makeup on.
Yes.
Yeah.
Doing a couple push-ups too.
Yeah. Get those
Things.
pumped up.
Yeah. Those
Yeah.
hammies.
Yeah.
This is going to be a good episode because we're going to talk about regenerative medicine.
Yep.
So I probably don't even need my disclaimer, but I'll say it anyways.
Always a good idea with you.
If I say anything crazy, I'm just joking. Don't hold it against my friends or family or Jim. Pretty simple.
Things come out.
Things come out and I'm like what you call diarrhea mouth. It comes out of nowhere. I don't really think about it. And it just falls out of my face. Sometimes my butt.
Yeah.
Okay.
Hence the diarrhea part.
Yeah.
So just know, I mean, no ill will.
I don't ever take it personally, and you'll
Good.
get it back because I'll just poison your cookies.
That's good.
So we're good. If you don't see Liv eating any of it,
Yeah.
yeah.
Just-
Don't think too much about it. You just enjoy.
Unfortunately, I am a cookie monster.
I
Yeah.
was like, he would not think anything about it.
No.
He would just eat them all for himself and wouldn't question.
Hello.
Why I have diarrhea later on. Yeah.
Yeah.
Yeah. Where did that come
Why
from?
do I have confetti butt?
Yeah.
That's why I call it when I think we talked about the different kind of poos
We did.
when it's essentially confetti.
It's not good.
No,
Not good.
not a good sign.
No.
Well, Miss Daisy, nice for you to join us.
I had to get
An inhaler.
Yeah.
Ooh, should we do any announcement about what happened yesterday or no?
Not on
this
this one.
Okay.
Oh.
Spoiler alert.
Foreshadowing.
How dare you?
People don't know when we recorded
Bill hates
this.
fun.
I do. I don't care if you guys.
Oh, look at him getting all shy.
I know. We should do it anyways, Liv.
Yeah,
Yeah.
I think so. Look at him.
Wow.
Looks like my cat.
So there will be an upcoming episode in which the boys will be talking about a promotion ceremony that we just had, in which Liv and I are very, very excited to announce you both got your black belts. We're so proud of you guys and all the hard work you've put in. There may have been a tear or two shed, but not from us. You two bitches. Crying uncontrollably.
Look,
It was a little
Andrew's
embarrassing.
BO was really bad.
I think the biggest takeaway from that whole thing is I got promoted first. So I think it was very, very deliberate.
I believe we all owe Lawrence $5.
Well, actually, because I asked him about it yesterday because he was acting so fucking weird.
What do you mean you asked him about it?
I'm like, are you not excited? Like, you didn't give Bill a hard time? He's like,
so after lunch?
yeah.
Okay.
And he said, no, I already told him I got promoted first when we got in line.
That didn't count though, because we didn't do our betting pool of when he would bring it
Yeah,
up.
so he already did. He'd already brought it up, so it was too
Actually-
late.
There was a betting pool of how soon you would bring it up.
Well, what was funny is as soon as I stood in line at the end of the line of the black belts, Professor Andrea leaned over and goes, "You got promoted first."
At least the whole gym is in on it.
Yeah. Yeah.
So anyway,
Well, the bet was you would bring it up at lunch directly after class or whatever. And you disappointed everyone except for Lawrence,
Yeah.
which he had his money. He had the whole house riding that you'd do it on the podcast. And you did it within 5 minutes.
it was actually while you were still up there giving your speech.
True, but we hadn't made our bets yet.
Right.
Yeah.
Okay.
Oh, I'm sure. Yeah.
Yeah.
And if I could just say, because everyone was sitting on the ground in the lines.
Mm-hmm.
I intentionally picked the spot after you because I'm a gracious God.
Dude, anybody that knows you knows that you had to sit there because you had no other spot to sit. You would not be gracious. You would, if you could have. You're like that guy with an old lady trying to get out of a house when there's a fire. You'd be the one to knock her out of the way to save yourself.
Well, strong do survive, yes. But I think I just felt bad because the last time we rolled, I threw you around like a child off of me. I was so pumped up because you were being mean to me that I was like, you know what? I got to let him win one.
Okay, thank you. I don't know what to say. I feel it's just so privileged that you were charitable in your role with me.
Was
I
that
was
your
like
thank
after-
you speech, Bill?
Yeah.
I should have said it.
That's like afterwards, after you roll someone, you know, you get your butt handed to, you know, to yourself. And, you know, then you go off and say, hey, you know, I was just taking it easy on him.
I was just drilling.
I was just drilling with him. You know, he's had a rough time lately. I wanted to give him a win.
Yeah.
Because I know that the gym would conspire against me in this fashion. I think even if I was sitting in front of you,
Yep.
you would have.
Been called first.
Yes.
100%. That was my point.
I could have been in the back row,
You know,
the
Bill,
white belt row.
Yeah, you could have been. And when you're a gym villain, that's what happens. You know, they will conspire against you. So,
Well, and also for the people that have listened to the podcast and have seen a few of our guests that we've had on, a shout out to Dr. Jonathan Chang, who got promoted to blue belt,
yeah.
and to Jared Pimentel, who got promoted to purple belt.
Yeah,
So-
both for our previous guests. Yeah, exactly.
Yep. So shout out to those guys.
Yeah. Very cool.
Yeah.
A lot of promotions, actually.
A lot of promotions. That's classy.
Sorry.
I got it.
Don't worry about it.
Nice. Was that also the gum that was up on the railing that Andrew knocked off yesterday?
No. It was under this table
That was disgusting.
Under the table, behind my ear.
There we go.
from a
It's
month
right there.
ago.
There we go.
Excellent.
Okay.
So, what are we talking about today?
We are going to talk about a little bit of regenerative medicine practices.
What the hell is that?
Yeah. So regenerative medicine actually goes back a very long way. It's become really popular over the last 5 or so years with, you know, people getting stem cell therapies, and we hear, you know, like Joe Rogan talking about getting things in his knees and his hips and his shoulders.
Panama, Mexico.
Exactly. But that's actually been a regenerative medicine, if we think about the actual definition of it, has been around for a very long time. Started way back. One of the definitions I even read was talking about like the artificial implants, right? So if we think about the first heart implant, that's regenerative medicine. Hip implants are considered regenerative medicine. So it's been around for a very long time without a fancy name, but like in the 90s, it really became much more mainstream or more discussed when people started talking about doing tissue engineering. So in the lab, they're growing like heart valves, or they're growing skin replacements, or they're trying to grow like
Human pig hybrids.
yes, pigman, exactly.
When were you born again?
None of your business.
I was going to say it's probably right around that time where we did
40 years ago.
We did the human pig experiments.
Yeah.
Yeah.
Yes.
Yeah.
And that's when the frogs started getting turned gay.
No, that was 1987.
Oh, my bad.
That's he's talking about environmental phthalates.
Okay.
Yeah,
That's making the taint shorter.
Yeah.
Yeah.
Short taints.
That's a whole nother conversation.
Is there some studying going on about frog taints?
Not frog taints, but human taints?
Right. Well, I know
Yeah.
perineum, you mean.
Yeah. Shauna, what
Look
was
at
her
the big
name?
brain.
Chris, Shauna, somebody. She was on Joe Rogan.
Yeah, she's a
Dr. Shauna, somebody. She's been measuring taints, noticing that y'all have short taints compared to that one.
Yep.
I use glass
I
beverage
think Bill
containers.
was pre
Tell him.
1987. So wasn't it 1987?
1983.
or 1990 that?
I don't know.
Okay.
Yeah. But anyways, that's not regenerative medicine. Although
I'll take my taint out right now.
that's part of regenerative medicine. I double dog dare you. Put it on that camera right there.
Look, Bill.
And let's measure.
You're used to having me across from you. If you throw something like that out at Carrie, she's going to call you.
It's on.
Okay.
It's on.
All right.
So anyway, regenerative medicine falls under 3 basic categories. So the molecular portion, which is kind of building blocks, cellular portions, which are things like stem cells, and then just straight up tissue where they're like transplanting tissue. So like, let's say you have a big burn, skin grafts, those kinds of things. Exactly. Blood vessels, muscles, those kinds of things are the 3 main categories in which regenerative medicine falls under. There's a lot of uses for regenerative medicine. We've kind of already talked about a couple of them, right? Organ transplants. They're also looking at it for some autoimmune conditions like type 1 diabetes, multiple sclerosis, brain tissue repair, cardiovascular tissue repair, the cellular therapies, the tissue engineering, organ transplant, and the skin stuff as well.
For our audience that, a lot of jiu-jitsu and grappling practitioners or sports types, we're usually interested in kind of the musculoskeletal applications.
Right. And we'll kind of get into that. I just want to lay some of the foundation for where regenerative medicine is, and it's still in a huge emerging field where they're looking at these different therapies. And then we'll talk more specifically about people that have like a chronic tendon strain or chronic ligament strain or a bone chip or something that's really not healing, and they're talking about like fusing someone, like where do we go from here? But let's understand terminology first, because people talk about stem cell therapy like it's this magical thing, and next thing you know, they're growing new shit. Like, are they really? And maybe not. Maybe it's something else within the stem cells that's coming in that's really helping towards healing.
Growing new stuff.
Right. And so often when people are thinking about things like stem cell therapy, so stem cells can come from all of our tissues have their own stem cells. Most often when we think about stem cell therapy, they think about something getting harvested from your bone, either the back of the hip bone or in the tibia, the big solid bone on the front of the lower leg. And when we think about that, so then the stem cells are being pulled out, those are mesenchymal stem cells that do have the potential to kind of become anything.
In the musculoskeletal system.
In the musculoskeletal system,
yeah.
Right. But they're still using those mesenchymal stem cells to look at other things like some of the neurological applications, and we'll talk a little bit more about that, but it needs more manipulation than what you're getting when you go to a traditional regenerative medicine practice. Normally they're just harvesting them out, spinning them down and concentrating them, and then putting them back into a place. So people think like, oh, I'm growing new cartilage. Perhaps you're growing some new cartilage, but you're really providing scaffold for your body to really do its own thing and to heal itself. So you're not just regrowing. It's not that simple.
Right.
We've made medicine, we try to dumb things down too much, and then people run around saying things that aren't quite exactly true.
Isn't this even the term stem cell replacement, isn't that a little off too?
No, they're still stem cells, right? But they're specific stem cells. Like Chris said, the ones we get from the bone really is more for like helping bone and ligament, tendon kind of heal. Like the heart has its own stem cells, the muscles have its own stem cells, the liver, which is one of the really great things. Like let's say you needed a liver transplant, or and you had a match and someone gave you half of their liver. That portion would grow, right? Because it has its own stem cells to try to regenerate and heal.
Just real quick, stem cells from embryonic origin or umbilical cord stem cells, things like that, are what are called pluripotent stem cells, which they can become any cell in the body, where like a mesenchymal stem cell has already gone down the pathway of what we call differentiation a little bit. In other words, they've gone down the branch of, hey, we're going to form some musculoskeletal stuff, right?
I thought I heard on like More Plates, More Dates, Derek on there. he was saying something, or maybe it was Rogan. They were talking about it, and the terminology wasn't quite accurate with, and maybe there's a specific case people are calling stem cell replacement or PRP something when it wasn't.
Yeah,
or,
PRP certainly is not stem cell replacement,
Okay.
and we'll get into the definitions
Okay,
of
cool.
those because when we talk about regenerative medicine, there's different therapies. There's cellular therapies and there's acellular therapies. Stem cells and another form, the embryonic from like the umbilical cord stem cells or Wharton's jelly. So those tend to be cellular, but there's also an acellular portion of the Wharton's jelly that we'll talk about as well. So the stem cells, again, come from a variety of tissues. Most people think about it, the bone marrow stuff, or in more of the aesthetic practices, they're pulling them from the fat cells also. And they are injecting some of those into joints as well. But those are the two most common practices in some of these regenerative medicine offices. They are able to proliferate, grow. They're able to self-renew, thus, the liver portion, right, that we just talked about. And they're able to form what's called colony-forming units. Most often people think about colony-forming units more when they think about things like bacteria, or if you get a probiotic and they talk about the number of CFUs you have in there. And that's their ability to aggregate and form these little raft-like structures for which things can grow off of. And so I think that's the regenerative portion of that. And the other thing that's really huge that people often overlook about stem cells is they have an ability to modulate the immune system. So to help bring inflammation where it's needed for healing, but also to decrease chronic low inflammation. But there's other things that needs to go into that also when we're talking about our regenerative medicine practices. The Wharton's jelly, since we'll stick with cellular stuff first, the Wharton's jelly comes from that connective tissue around the umbilical cord off of the baby, right? So connects baby to the placenta. That also has its own stem cells, which Chris already alluded to. But then there's also an acellular portion that has a lot more of the growth factors with it that help with tissue healing. Exosomes, and we've talked briefly, I think, a couple of times about exosomes on here, are also signaling agents. They're typically isolated from things like the umbilical cord or more frequently the placenta, that have a lot of molecules with them, most notably some microRNAs that can help signal healing. That's really helpful.
With the Wharton's jelly, if we could stay on that for a second, I think Gordon Ryan mentioned he went through some treatment with the Wharton's jelly, and it helped a tremendous amount with his stomach issues. I don't know if you guys know exactly what he ended up having.
And the delivery mechanism would be really interesting. I mean, Carrie, I can talk about my experiences. Carrie injected me with some Wharton's jelly near my lower back recently, and I can tell you about that. But with the GI issues, and I would have to see what protocols they're using. Would you think they did something IV with him?
Yeah, most likely.
Intravenous, right?
Yeah.
Did he have gastroparesis or?
Yeah.
That was like a part of it, at least.
Yeah, gastroparesis. There's all kinds of reasons for gastroparesis.
So what is Wharton's jelly? Because, I mean, it's a weird-ass name.
It's the connective tissue. So if we look at the umbilical cord, it's got like a sausage casing on the outside of it. There's this gelatinous thing which houses 3 vessels, right? The 3 vessels that bring nutrients into the baby and take waste away as the baby's developing. So it is that gelatinous stuff that's covering the vessels that's in the sausage casing.
Okay.
Yeah.
And they name things like the person that kind of discovered it from a pathology point of view. Maybe his name, I don't know. Like Wharton.
I didn't.
Doctors like to name stuff after themselves when they do that.
Yeah.
You guys are a special breed.
Yeah.
We just want to be remembered.
Oh, okay.
Yeah.
Okay.
Yeah.
And what are the most common usages for Wharton's jelly?
We'll get into usages in a few moments.
She wants. I think you're trying to just do definitions so we all know what we're talking about.
Right. And then the last one is the PRP that you brought up. So that's platelet-rich plasma. And that is another acellular component in which there is a lot of just growth factors in there that can really, again, help with healing overall. So the common theme here between these basic modalities is the stimulation of growth factors and reducing inflammation that will help come in to correct an area in which there's an injury or something that's ongoing. And there's a lot of research. There's people say, oh, there's no research behind PRP or there's no research behind stem cells. Well, I don't know what studies they're pulling. I mean, I have just a short stack here of the things that I pulled up that I thought would be most beneficial for our discussion today. But there's new studies coming out all the time. And the one about PRP goes back several years. We'll talk a little bit about BPC 157, which is a peptide that can be helpful in these therapies also, that there's studies going back to like 2010 on that, which is crazy that we're just really kind of catching up, but that's kind of bench science to medicine takes a good 10 to 15 years. So
at least.
Yeah, I guess I shouldn't be too terribly surprised.
Well, then you have insurance companies and other special interests that really are pushing back against getting it accepted.
Oh, yeah.
Not to be conspiracy theorists, but if you think about just follow the money, if you have regenerative medicine techniques that could potentially save someone from, let's say, shoulder surgery, there's whole industries of medical devices, surgical kits, things like that, that is billions of dollars of industry. And if you stop having as many surgeries, that's a huge section of the market that's kind of at threat, I guess.
Well, and so some of those things, though, when we think about some of these therapies right now, we don't know what the longevity of them are, right? And so those therapies are still maybe needed as far as like a total hip replacement, et cetera. Yep. But maybe we can kick that can a little further down the road and give them a better quality of life in between. And so that's probably one of the worst things that happens in medicine is this competitive nature in which we try to cloister, we try to make this is mine and I'm not going to share this information or this, I'm going to denigrate this side of things because it doesn't fill my pockets. And that's not what medicine should be. We should be about healing people and giving them options and giving them information so that they can decide what's best for them as they move down the road.
And that I think that Joe Rogan episode with Brigham.
Brigham?
Yeah.
From ways to well.
Was eye-opening because he's kind of been at every level in that world.
I highly recommend, if people haven't listened to that.
Really broke it down.
It's excellent to kind of get, and it should make you a little angry.
Yeah.
If you listen to
definitely will.
Yeah.
Okay.
And so then, Bill, you brought up like, okay, well, where are these things being used? And you'll find that there's a lot of overlapping things in which these different regenerative medicine practices are being found in. So stem cells, and this is just the short list out of some of the journal articles that I pulled up. Obviously, cartilage repair, bone deficits, tendon and ligament repair, things like central nervous system diseases like Parkinson's, ALS, MS, which is autoimmune and nervous system, strokes, especially ischemic strokes. They're looking at using these stem cells not directly from your hip, the back of your hip, but these are being modulated. So as Chris mentioned, these cells tend to have a tendency to want to become something else. So we have to help guide them to be more nerve tissue things. So they have to be manipulated within a lab, put into some growth medium, and then they're transplanting them back into patients to help correct some of these neurological conditions.
Really quick, in general, a stem cell, especially one that hasn't picked a path, relies on its environment signals from its immediate environment, like, oh, I'm around a bunch of cartilage. That environment will kind of signal it to kind of develop into whatever tissue kind of is around it. So if you take a stem cell out, let's say you want to make some stuff that will differentiate into nerve tissue, you can even artificially putting it in an environment with those growth factors and signaling molecules to have that stem cell kind of go down that path.
Yeah.
So
that makes sense.
Yeah. Is that normal practice, or is there a little bit of a, so there might be clinics that are like kind of like testosterone?
Yeah, no.
I'm just going to shoot you with this PRP. It's going to be great. Give me your $800 or that. Who knows how? I don't know how much that stuff is. But
yeah, unfortunately, so the stem cell thing, there's definitely some clinics out there. There's a lot of great clinics out there doing the right thing. There's a lot of clinics. There's also a lot of clinics out there that are seeing a buck. Right. And so they're taking your money. I unfortunately had one of my patients had an autoimmune condition, and a clinic had her pay, I can't remember. So it turned out to be, several $1,000s for the series of treatments for some peripheral neuropathy with PRP. I'm like, well, it's not been really studied for that. Like, I don't think you're necessarily going to have a good outcome.
So to your point, like if what Carrie does, if a patient comes in like, hey, I want to get PRP for my peripheral neuropathy, she'll say, hey, no, it really hadn't been studied. And I can't, we don't know if that's even going to help. Instead of just, I'll just take your money and we'll do it.
We'll see.
It's not, it's not ethical.
And then another 3 months of pain or whatever they're going through. And
several $1,000s.
Sure.
Right. And none of these things are covered by insurance. So it's all an out-of-pocket expense.
When you say none of these things, like
Wharton's jelly, stem cells, PRP, exosomes, they're not it's always going to be an out-of-pocket expense because insurance is not covering that. They may cover your initial office visit, but they're not going to cover
the treatments
themselves.
So is that a new science, regenerative medicine?
Well, it's been around since the 90s, right?
Right. That's why I did quotes. Audio listeners.
And they're still looking at, so like when we talked about the things like the Parkinson's disease, the ALS, they're doing clinical trials now. But that's not something where they can just pull out your stem cells and then give them back to you. Like, let's say we're talking about Parkinson's, give them back to you as like a nasal spray or an IV infusion, and you're going to suddenly get better. Those have to go into the lab. They have to undergo some pressure to change. So putting in those growth factors to make them more nerve-like
there's
cells.
A lot that's going into the process.
And right now, the FDA, I don't know if there's how those lawsuits have settled out, but over the last several years, there's been lawsuits where the FDA has gone through and has closed down stem cell banks, stem cell clinics, saying that people were doing more than minimal manipulation. And if you do more than minimal manipulation, which means if I do something other than take your stem cells from your bone marrow, spin it down, concentrate it, and inject it back in, if I do more than that, I'm making a drug. It's your stuff. Yours is different than Chris's. Yours is different than Liv's.
Yeah.
I don't know. You eat a lot of shit. So anyway, so that's, that's more than minimal manipulation. They're calling it a drug, even though it's something very specific to you.
They just lost that lawsuit.
Did they?
The FDA just lost a lawsuit against the guy in Beverly Hills.
Yeah. Oh, yeah.
Yeah, they lost that one.
Yeah.
But
that's going to be a big deal, right? Because that'll set some sort of precedent.
It can, but it's not a one or the other. For instance, for certain conditions, PRP, let's say lateral epicondylitis, otherwise known as tennis elbow.
Sure.
That has a ton. There's randomized controlled trials have been done on that shows it's superior to all those other interventional techniques like corticosteroids and all that.
Well, that's a whole other thing.
I know.
Dip into, yeah.
But my point is, even with all that now we're looking at decades of showing the effectiveness of that for that condition. Their insurance companies still aren't covering that, which I think they should. But on the other hand, some of these things are still very investigational, and there's not a whole lot of data. So there's that too. It depends on what we're talking about, what application.
Yeah, yeah. Other things that stem cells can be used for: repairing the heart, repairing the liver, corneal regeneration, trachea. So if someone's had to have their trachea removed, say from cancer, they are using those stem cells, putting them on scaffolds to regenerate the trachea. And then the skin stuff, like skin goes through all of these modalities as far as being helpful for that.
If you had to guess, why is insurance not covering these?
Kind of just what I said. Some of them, they're well within their rights not to, because some of these applications haven't been studied well enough in a long-term basis, right?
So it's okay. They're just not there yet.
They're not there yet.
Yeah.
But my point is, some of these applications have been studied very well.
90s stuff. Okay.
And especially the one I just gave the example where I don't have a good answer to that, why they're not covering it, except for looking at expense and having to,
Yeah. Once again, going back to the Brigham thing, the podcast where he, breaks down. It's not necessarily a pharmaceutical company, which is the head of the snake. It's the insurance company.
That's
but
right.
obviously there's connections there.
But there could be other things, right?
Yeah.
So if we're talking about like knees or hips or, heart stuff, like the implant companies, those medical device companies,
Sure.
like what is their
Yeah.
lobbyist like? How are they keeping
I feel
these
like I
other
could
modalities
make
out?
more money if Carrie needs a hip, and I can identify it, and I can put you on a painkiller for a while, just to soothe the pain. Let's see if some physical therapy helps or something like that. But here's pharmaceuticals. Bam, bam. Okay, well, that didn't work out. Hip got worse. Now you need a procedure. So it's almost, rather than, well, if I just give you exosomes or PRP, whatever you would use in that scenario, and that fixes it, our potential for revenue is much less.
Right. And so we've lost that whole piece of medicine really should be about healing the patient as opposed to whose pocket are we filling.
Yeah. And different branches of being able to fill it too.
Right. And so, some of the, and I get it, there's a fine line between undervaluing your services and helping the patient and making sure that things are covered. And I think most independent practitioners kind of struggle with some of that, like, what is your worth? And just being upfront, like, here's our modalities. And then the other thing is some of these research studies, like there's one when we get to talking about PRP and the osteoarthritis piece, like they're only talking about a single injection. When most of us learn these techniques, like whether it's regardless, stem cells, exosomes, PRP, Wharton's jelly, rarely is it one and done, right? Because if you've had these injuries for a very long period of time, we still got to work to reduce that inflammation. And there's not just a single bullet out there for anything, right? That just says, okay, well, this is going to fix it. You're good to go. Our medicine isn't that advanced yet.
Jack Daniels.
I kind of like gin.
Okay.
So
Okay.
yeah.
Some would argue that those fix things pretty quick.
They do, for at least like an hour, and then it's right back where you were.
Right.
But so some of these studies I think are a little bit flawed, and maybe that's just my arrogance. But when we go through and we learn these modalities, and go to some of these different conferences, rarely is it just one, right? So it can be a series, like if we don't see anything after like your third injection, then we need to figure something else out. Like we don't want to be doing the same shit a year later and baffled, like, why hasn't this worked? Because now you're just stealing someone's money. But also you shouldn't be selling therapies that don't have some support behind it. So that just, I can't explain why insurances won't cover it.
Sure.
They just don't. maybe in another 10 years they will. But, you know, if the FDA is involved in your stem cells, right, when they have no business being involved in your stem cells, that's telling me that there's some sort of pharmaceutical medical device overreach that's become invasive within our system.
We know about the revolving door of the FDA.
Oh, yeah.
So I mean, it's absurd.
Yeah.
Should never be allowed.
Yeah.
But you know, you were talking about some of these. You know, how you're getting the data you're getting. A lot of the things, Carrie goes to conferences all the time, and she's meeting with physicians from all over the country and sometimes all over the world. And some of the earliest data we get is from those collaborative physician meetings where they're sharing their quote unquote anecdotal case studies, which is the first level of evidence, right? And that's how things like, hey, we're seeing this. What are you guys seeing? Oh, we're seeing this. We typically, you know, and that's how you start to develop a practice. And then the studies will come and do some confirmatory or, you know, see what's actually going on. Typically is how it's worked. Once we see like a groundswell developing at the clinics level.
Yeah. So back to kind of some applications, and again, we'll see things that are definitely overlapping. So we went through what stem cells have been studied for thus far as my research has shown. Exosomes, huge for skin. The place that I purchased my exosomes from, Chimera Labs, one of the first things that they showed us in one of my conferences was this gentleman that had like severe second-degree burns on his face, and just using exosome therapy, like you would. There's no scarring. There's no changing in skin texture, in skin tone. And so it's huge for skin. They're also looking at exosomes specifically for strokes, Parkinson's disease specifically also. The exosomes more derived from the stem cells, arthritis and bone regeneration, traumatic brain injuries, which I thought was really interesting. They're using a nasal spray because the exosomes will cross that blood-brain barrier. So there's 3 privileged sites: the eye, the brain, the uterus, in the body, and not uterus for you guys, because you don't have one of those.
You can't
At least
prove
not
that.
that we. I bet I can. Ultrasound your abdomen if it's not there.
I didn't think you were going to say abdomen.
There you go.
Ultrasound my behind.
We can put a probe up there and still look in your
I
abdomen.
didn't say a probe. I said an ultrasound.
That's what a probe is. Yeah, there's an ultrasound probe that goes up there.
Good,
Yeah.
you passed the test.
Yeah. And then cardiovascular disease and liver health. The Wharton's jelly, they're really looking at that for bone regeneration to include defects in the bone, also degenerative joint disease and peripheral nerve damage. And the peripheral nerve damage, those have really only been rodent studies thus far where they've done like a crush injury on like the big sciatic nerve. So those people are like, oh, I got sciatica pain. Like, okay.
Yeah.
It's that huge nerve that comes down and starts to supply the lower leg.
I knew a guy that was having, well, I mean, he said his sciatic. And then he would like massage it, like get really in there. That would help. But it got to a point where it wasn't helping a whole lot.
Yeah.
And he said he would work it so much, he was like peeing blood. Is that real? I'm not saying it's not real, but
I don't know what he was working.
That anatomically doesn't make any sense.
Yeah.
I don't know what he was working.
Yeah.
What it sounds like is he had a piriformis entrapment of the sciatic nerve.
that's what I told him. Yeah.
Yeah.
Which, if you're massaging that and you're peeing blood, there's something weird going on. Cause
Yeah.
there's
Just for the people that don't know,
Your-
can you explain what that is?
Your butt and your kidneys aren't connected.
Yeah, the piriformis is a deep rotator of the hip, and it's positioned in a place where the sciatic nerve travels right below it. In a certain amount of the population, it actually the sciatic nerve pierces the piriformis muscle belly. So some people that have like a piriformis that is getting tight and is spasming, it will actually compress the sciatic nerve, causing quote unquote sciatica, which is really not a really good diagnosis.
Yeah.
It's not really a
And to break it down even further for those people that like that's within the butt muscles, right? So there's 3 gluteal muscles, right? And they're under, the piriformis is underneath that. And often it's, wouldn't you say, Chris, it's more of an gluteal inactivation and over tightness of the psoas that's causing that
Absolutely.
piriformis to be out of balance.
Because when the hip isn't getting the correct stabilization from the big muscles, the small ones try to make up for it.
Yeah. So massaging it isn't going to correct the problem, which is a muscle imbalance.
And certainly not going to cause blood. So he has something else going on.
He must be massaging something else.
Look out.
You could injure the prostate now.
Hey, now we're talking.
Yeah. And so now that could make you pee a little blood.
But then he's like going through the perineum or
That's
something
right.
weird.
That's what I'm saying.
Oh, he went from the bottom, not the...
Yeah.
Yeah, that's not the piriformis.
No.
So, go ahead.
I was going to ask Carrie. So for that guy that had the burns, was it a topical that they put on his skin?
Yeah. They just did a little topical like cream for him.
And then for, because you said that they are using it or trying to use it for TBIs, would it also work for Alzheimer's?
So they're looking at, I don't know if they looked at Alzheimer's in particular. When I was going through, and looking about some of the neurological disorders, because I did a talk for our local Parkinson's group here not too long ago, and I was looking at some emerging therapies for them and letting them know, like, hey, look into these trials. I think they may have mentioned Alzheimer's, but I'm not absolutely certain.
Okay.
Yeah, but the exosomes for the TBI, that was really interesting because that was a nasal spray. So if they could figure out a way to do that more frequently, I don't know why it wouldn't be helpful, right? But there's all kinds of underlying health issues, and we'll kind of get into that here in a few moments that just help with healing overall. And just because you may have the genetics for Alzheimer's doesn't mean you have to go down that route, right? And I know Chris has had that conversation several times on the podcast. Like, that's just the blueprint to tell us where we're going.
The epigenetics seems to be a lot more important.
Exactly.
The environmental signals and things, which include food, stress, the whole night, sleep, all that stuff.
Yeah. So,
Is it considered regenerative medicine when they do that process where they put someone else's poop in your butt?
it should be.
Right?
I haven't seen that called that, but it should be, right? Because we're